Hi, this is Dr. Tim Smith from New Life Chiropractic, your max living doctor. Today I want to talk about the underlying cause of shoulder issues that is ignored by your doctor. Most people don't really understand what's causing their issues, therefore they're just stuck treating symptoms or effects and never really getting better, which is going to lead to more medications, more surgeries, and more pain ultimately. That's going to take away from your quality of life. This would include any type of shoulder sprains and strains, rotator cuff injuries, bursitis, repetitive stress injuries. Even major damage can be corrected naturally through the right type of techniques when you're addressing the ignored causes that nobody's looking at. Most shoulder issues actually stem from the neck. And I want to explain to you today exactly why that is. When we look at the spine, number one is you need to have a curve in your neck. The reason why that's important is because these muscles actually control all the nerves into your shoulder and into your arm. Nothing in your body can heal without first getting a signal from the brain through the nervous system out to those joints and tissues. So if there's an interrupted signal in the neck because you've lost the normal curve, because your spine is shifted out of its normal alignment, this is going to affect these nerves. If these are the nerves that are going into your shoulder, going into your arm, that's going to keep your body from healing and repairing the way that it's designed to. So I'm going to show you exactly what this looks like on an x-ray and how we're able to evaluate this through exam and nerve scans to help find the underlying cause of many people's shoulder issues and why we're seeing a significant improvement to complete restoration of shoulder function in a relatively short period of time in a majority of our patients, even when their medical doctor, PT, massage therapist weren't able to help them, because we're actually addressing those ignored underlying causes. This here behind me is a diagram of how your nervous system works. And if you look closely here at the bottom part of the neck, this shows that these are the muscles that go into your neck, your shoulders, and when these nerves are being irritated from misalignments in the spine, a very specific condition called subluxation, which no doctor looks for, it's going to affect stiff neck, pain in the upper arm, pain down into the arms. This is one of the primary causes of shoulder issues that we help find and correct for our patients. This is another test that we do. This is a computerized nerve scan. We can actually look at the nerves that come from your spine that travel out to your muscles to see what's working and what's not. If you look up here in this corner, this is what's called an EMG, electromyogram. It's a scan we do to be able to look at the nerve supply into the muscles of your body to see how your body's adapting to stress. When you've lost the normal alignment of your spine, this causes stress on those nerves and they have to start working harder than normal. For many people, this creates tightness, tension. So a lot of people with shoulder problems also have stiff neck, stiff upper back, chronic pain issues, sometimes even numbness, tingling into the arm. It's because of these nerves in the neck that are being stressed and that issue is not being addressed. And the worst thing you could do is go in there and relax the tight muscles, take an Advil, ibuprofen, get in and take muscle relaxers, because the tight muscles is your body's natural response to try to protect the shoulder and the neck. But if you go in and relax that, you're actually making the problem worse. Not to mention the dangerous side effects that exist in those, especially if you're going to the next level and you're getting injections and shots and steroids and epidurals. These have been shown to speed up the degeneration of joints and tissues, and this is what leads people to get to surgery, because they're covering up the symptom, which is the body's intelligent response to tell you there's a problem. They're getting tight muscles and other issues, which is the body's natural response to protect those joints and tissues. Therefore, you're causing more damage and you're weakening the joints and systems both structurally and neurologically, and then eventually you cause so much damage it's beyond repair. That's what leads to surgeries and very serious injuries. We can prevent all of that by catching it early and fixing the underlying cause. And rather than treating symptoms, focus on correcting that cause to restore normal function so your body can heal itself the way it was designed to, without medications, without shots and surgeries. I'm going to show you exactly how we do that. So this is an x-ray of the neck. This is what I commonly see with individuals that come in with shoulder problems. You can see here the neck is totally straight. Ideally, you need to have a 40 to 45 degree curve in your neck. When you lose the curve in the neck, what happens is this puts significant stress on the spinal cord and on these nerves. And like I said earlier, these nerves stimulate the muscles, so now these muscles are working 2-3 times harder than they have to. Also, what happens is these nerves control what's called proprioception, which is how your joints communicate back to the brain. When these nerves are under stress from subluxation, misalignments in the spine, like you see here on this x-ray, these muscles, they start to fatigue more quickly, they react more slowly. They also don't recover as quickly, and you're much more likely to get injured. This is why many athletes, weekend warriors, even just your standard person that sits at a desk all day, gets shoulder and arm issues because the nerves in the neck are under constant stress and nobody's addressing the real issue. Until we take an x-ray, we're ignoring the true cause of what's going on. So when we see an x-ray like this, we know this is not only affecting the neck, this is affecting the shoulders and the entire arm. So what you want to do is you want to find a corrective care chiropractor who's trained specifically in not just finding these issues, but correcting it. And that's exactly what we do. We do a corrective level care that restores the normal structure and function of the spine, which corrects the nerve issues that are the ultimate cause of why you're having the problems in the first place. So we're able to take somebody like this to like this in 3 to 6 months through the advanced corrective techniques that we're doing here in the office. And this is the difference between treating symptoms and correcting cause. This individual here had been dealing with shoulder problems for 2 years. He'd been to every doctor, he tried everything, tried massage, exercise, he'd done the medication, he'd done the shots. The doctor told him all he could do was have surgery. Now he had already had surgery on the left shoulder and that didn't work. And he was about to get surgery on the right shoulder until someone finally referred him into the office and were able to find the true cause that no other doctor looked at. And in 3 to 6 months, we took him over to here, where now he's having no more shoulder issues. He's able to work out again. Every single time he comes in, he tells me how appreciative he is that he never had to get surgery. He's taking no more medications, and he's been able to resume normal activity that he wasn't able to do that was significantly limiting the quality of his life and the enjoyment that he had. And that's really what it's all about. Correcting the cause, restoring function, so you can live a better life and enjoy the activities that you love to do and avoid the drugs and surgeries that are very dangerous and detrimental to your health. So in addition to the corrective chiropractic care we do, there are specific exercises that we do recommend our patients, the things that you can start doing now to help rehab a shoulder issue. Now, if you have a severe pain that's not going away, I recommend you get in and see a corrective care chiropractor immediately. And I'm going to leave some links in this video to show you exactly how to do that. But there's someone that you can start doing right away. So I'm going to demonstrate to you some exercises right now that you can start doing to help rehabilitate the shoulder. There's a simple progression. I'm going to start with the easiest beginner version, and then we're going to work our way up to more of an advanced level to be able to do that. Now, just as a disclaimer, if you're having chronic shoulder problems that aren't resolving, if you have instability or major injuries to the shoulders, you want to make sure you consult a corrective care chiropractor prior to doing this, so that way you're able to fix the underlying cause that we talked about previously. These are exercises that we give our patients in conjunction with the corrective care they're already receiving in the office. So this first exercise is relatively simple. You'll take 2.5 to 5 pound weights. This is a 5-pound dumbbell. You're going to have your palms facing forward with your shoulders locked out, with your shoulders back and your chin slightly up. And all you're going to do is let your arms slowly swing forward and back like a pendulum. This is helping decompress the shoulder joint, the labrum, stretch and strengthen the rotator cuff muscles, bringing in oxygen, nutrients, blood flow to the joints, and flushing out toxins and inflammation. This is very easy to do. This is what it looks like from the side. You want to do this 50 to 100 times a day. Now I want to show you the wrong version as well. 2 things you want to look out for. Number 1 is you don't want the chest to move. My chest should not be moving as I'm doing this. Number 2 is you want to make sure your chin doesn't get chucked down. If you're doing one of these 2 ways, you're doing it completely wrong. So the next level up in the progression is we're going to use slightly heavier weights. These are 10-pound dumbbells. You can still do the same pendulum swing exercise, but now we're going to add in some strengthening exercises as well. Number 1 is abduction, which is with my hands down at my sides, my palms facing towards me, and lifting my shoulders straight up. You want to do this anywhere from 15 to 30 times. This is not a strengthening exercise to see how strong you are, how much weight you can do. You should be able to do it easily and multiple times. The second one is to be able to push your palms out away from you and do the same thing, up and down. Again, 15 to 30 times. And the last one is going to be a shoulder press, where you start with your palm facing towards you, push it up and away. You can do it on both sides. And you want to alternate. Again, 15 to 30 times on this. We're not seeing how strong we are. We just want to get motion in the shoulder and start to strengthen and stabilize the supporting muscles of that shoulder. The third exercise is the most advanced in the progression here. I'm now using a TheraBand. This is a type of exercise band that we use for many different areas of rehabilitation in the office. Now for this one specifically, you don't want to do if you have any instability in the shoulder or any major dislocations, because it's putting a lot of stress on the shoulder, more stress than any of the other exercises that we've done. This is about 10 to 15 pounds. You can do this as much as 20 to 25 pounds of resistance. The way we're going to work here is we're going to create tension and bring that apart, and then bring my shoulders behind me, and then back forward again. Now you'll feel this at the point of greatest tension in your shoulder. For me, that happens about right here. You come back. Same thing, 15 to 30 times of this as part of your shoulder rehabilitation to help completely stabilize that whole area. If you start working on these exercises, it's going to help rehab that shoulder. Again, if you notice any chronic pain, worsening pain, or you find that it's not improving, you want to make sure you're getting to a corrective care chiropractor as soon as possible to address the underlying issues that's coming from the neck and the nerve supply. Yeah. So the reason why we do this video is because many people are suffering with shoulder issues. In fact, myself, I had injuries to my shoulder from playing baseball and other dislocations that caused major damage to my shoulder. And like many people, my doctor just prescribed medications, typically ibuprofen or ice, that led to very severe injuries that eventually led to the ending of my career. Unfortunately, which was very sad, I didn't find chiropractic until later on, and I found that when we did the x-rays of my neck, I had a complete loss of my curve, and I had been going about the shoulder care all wrong, which is what led to the major injuries that I experienced. I see people like this coming in all the time. And now, thankfully, I've been able to not only rehab my shoulder to where I've resumed normal function, but we've been able to help many other people who are struggling with shoulder problems that's limiting their ability to do the exercises, activities, and things that they love. And instead of being prescribed more medications and getting more shots and surgeries, you can help find a natural solution where the body's able to heal itself without all those other dangerous medical interventions. If you're looking to learn more about this, make sure you subscribe to our YouTube channel, where we have all types of videos on natural, healthy solutions by helping the body heal itself. If you want to come into our office to be assessed to see what we can do to be able to help you personally, you can find us online at maxlivingrockland.com. If you live far outside the area and it's not possible for you to make it in here, we can help you find a corrective care chiropractor in your area that can first assess the spine and the nervous system to see the root cause of your issues, and can help you through the correction process to be able to get better so you can resume the activities that you love, live in the quality of life that you deserve.